Things that make you say, according to a website put up by the Trump administration in May, the official position of the government now is that there had been a lab leak. A lab leak. An accident. Apparently, some reprehensible scientists working on dangerous research in China had been rather lackadaisical in their safety protocols and had a little oopsie, which had resulted in an accident now responsible for killing more people than Adolf Hitler in the Holocaust. And at least, according to the news, the former director of NIAID had some connection to this very dangerous research that had accidentally leaked and that had resulted in the pandemic that he had predicted all the way back in 2017. How does one predict an accident before it happens? I cannot say. And perhaps that is yet another reason why I shall never be elected to the American Congress. Things that make you say, Nevertheless, there is a brand new case involving a rather, shall we say, eccentric fellow, bit of a spook type, and that has most recently arrived, of all places, at the Supreme Court. And over 6,000 cases arrive each year, hoping to be granted a right to proceed, but only about 70 make it to the grand slam opportunity to be granted an oral argument before the 9 justices on the Supreme Court, who are rather most selective in the cases that they decide, limited to those cases that present the most compelling reasons and that say the most about who Americans really are. In fact, it is more competitive than trying to get into Harvard University, they say. But let me tell you a little bit about this rather spooky case. Things that make you say, For one, even though it is not in the news, the dailies, as we say, or generating any press releases, the defendants are two of the highest profile defendants that one could ever imagine. Meta Platforms Inc., the largest social media platform in the entire world, with over 253 million users just in the United States, and over 3 billion users worldwide. That's a sprinkle. Meta Platforms has retained not only the best international law firm in San Francisco, but has also tapped one of the top 25 elite appellate partners in the United States for this case. And rather most intriguingly, this case has not made even a footnote mention in the news headlines, which kind of makes a reasonable person wonder why. As if someone told Chief to use the, as they say, tone of silence. Things that make you say. The headlines, however, have been filled with the congressional testimony of the esteemed Anthony Fauci, who had been once, at least according to Al Jazeera, the most trusted voice for separating fact from fiction. And his most recent decision in the news today to elect a rather dubious right to remain silent, spawning calls for him to abandon his constitutional right against self-incrimination. But does anyone tell a police officer that they have been driving far over the speed limit when a police officer inquires, do you know exactly how fast you were going? Probably not. Things that might you say. What some like to describe as fake news, in reality, usually depends on whether you agree or not with the outcome. And that is what makes the second defendant rather an interesting character in this matter now, on what attorneys describe as a petition for certiorari at the Supreme Court. Standing side by side with attorneys from Meta Platforms, Inc., is none other than the White House and the Executive Office of the President. How does that not make any news? That's a very interesting question in itself. Things that might you say. But let me tell you a little bit more about what this very quiet case is all about. Being handled rather discreetly, as I say. Would you believe that it is another case also about the COVID-19 pandemic, but not in the news? And in fact, another case arising under the Freedom of Information Act, like a gentleman most recently got arrested for FOIA. And this case begins all the way back to the observation of the first anniversary of the pandemic, all the way back to March 2021, and not a single word about it has been printed in the press. On either side of the political and ideological echo chamber spectrum, and a reasonable person would have to wonder exactly why. Let me tell you a little bit more about this rather novel, spooky case. Things that might you say. Some may recall way back in mid-April 2020, when quite a lot of spooky news was actually popping up all over the place. George Stephanopoulos on Good Morning America was reporting that DIA, the Defense Intelligence Agency, had known about the outbreak as early as November 2019. While Sir Richard Dealer, the former director of MI6, was in the news. One of those guys who works with James Bond had been claiming that there had been a lab leak. And in the meanwhile, former acting director of the CIA, Michael J. Morrell, had been telling CBS News that according to his experts at the CIA, that COVID-19 would be with us for some time, perhaps just 18 to 24 months, which had been the opinion of many of his medical experts at the CIA, barring a breakthrough with either a vaccine or an antiviral, which we had delivered at warp speed with the Defense Production Act and the emergency use authorizations. But what? If the pandemic would only last, at most, for 24 months, 2 years, at least in retrospect, it would seem that the vaccines that had begun to roll out in December 2020 would have arrived too late to make a difference to shorten the pandemic. And if an antiviral or vaccine should have shortened the pandemic, why did this pandemic last for 3 years, not terminating until May 2023? In fact, in America, still leading the world in fatalities, 78% of the fatalities, over 20,000 last year, were in the United States. But didn't this pandemic begin in China? This stuff can all be rather confusing when you really start to think about it. Things that might you say. But anyway, just a month after the pandemic declaration, in mid-April 2020, National Geographic, very very popular magazine, had published a rather provocative article about the possibility that a single droplet might actually travel as far as 26 feet. At a time when the government officials were advising the general public to participate in social distancing, but only limiting the safety buffer to just 6 feet. And that certainly had caused quite a stir, as one might imagine, especially for those who had only read the provocative headline. You don't sell paper without a provocative headline. Thanks, it might just say, But if you had perhaps a little more time during the evolutionary pressure of a lethal pandemic to dedicate to that particular story, and had happened to catch the 10th paragraph down, you would learn that even more alarming, should that droplet happen to travel the enormous distance of 26 feet, to fall prey upon an unsuspecting person, perhaps a child, even an elderly person, the most vulnerable in the pandemic, lulled into a false sense of security by government guidance to just stay 6 feet apart. According to Joshua Santarpia, today a professor of pathology, microbiology, and immunology at the University of Nebraska, we don't have an infectious dose yet. This was April 2020. And he had said how many particles in that droplet that you would have to be exposed to become ill with COVID-19 is very hard to say. Very hard to say. Why would that be? With today 220 viruses harmful to mankind, nobody yet has figured out how to determine this metric. We put a man on the moon. Thanks. That might just say. But this boy across the Bishop's boy had decided to check it out. And long before April 2020, the International Encyclopedia of Public Health, a credible source, had determined that a highly contagious disease like COVID-19, reportedly, and bearing in mind that highly contagious diseases are actually a rather rare occurrence in nature. There really are not a lot of highly contagious disease because they require no more than 15 particles to be transmitted in what virologists, microbiologists, even epidemiologists describe as infectious dose. Sometimes you'll see ID, sometimes you'll see TCID. A basic epidemiological metric for assessment of transmissibility risk. Even according to Epidemiology for Dummies course published by the CDC online that anybody could read. I believe it's lesson 3. So why did a professor at the University of Nebraska in April 2020, when people were dying all around the world, tell National Geographic that discovering this basic metric might require evolving science? He did not say. Thinks that Mike is saying, When you think about it, this is just the how many licks does it take to get to the center of a Tootsie Roll Pop test. But the viruses. And the world was not already ready to address this problem on day one, even in the Trump administration. We can build contraptions that measure how much COVID-19 is in the sewage. We can create filtration systems. We can have all of these other types of things, even distribute masks, all this stuff that we did in the pandemic. But we don't know how many particles it takes to infect someone. And so, this boy requested, Bishop's boy, A bit daft too, if you ask me. Again, decided to check it out. It just sounds a bit peculiar, raising what police detectives, at least on television, might describe as a reasonable suspicion that something of a rather nefarious nature might be afoot. Things that might just say, And this is where the story really starts to get more interesting, if we can imagine that. By July of 2020, another fellow, Michael T. Osterholm, a well-known figure in global health, in the top 100 for Time magazine. Not everyone gets into Time magazine. And the director for the Center for Infectious Disease Research and Policy, CIDRAP, at the University of Minnesota School of Public Health. It's a very important person. He had claimed, even then, that scientists don't yet know the infectious dose of the virus that causes COVID-19. But of course, this was in Trump administration, and everyone said that the Trump administration rejected the science, so it doesn't make entirely no sense at all, but it was happening all over the world. In July 2020, he had claimed that data from animal studies and evidence from other viruses could provide important clues about this unknown quantum. And so he had proposed to begin to utilize mathematical models to resolve this then still purportedly mysterious problem. Around the same time, an organization called One Day Sooner was also in the press over in the UK, talking about recruiting 38,000 volunteers to do basically the same test. Between the ages of 18 and 25, these daring individuals decided that they were going to risk their lives for science and have these particles inoculated into their nose to see if they could catch COVID-19 and find out how many particles. Unfortunately, that research was not published until March of 2022. That research, it turns out, from 38,000, had only selected 36 individuals for this study. Why not a larger sample size? To ensure credibility and believability. Only 36 were chosen. And this researcher, Ben Killingsley, does not tell us why from 38,000 people he only chose these 36 people, as if he knew somehow that these people might be more inclined to be infected than others. Why? He does not say. But still, there is only one problem with the stories that had appeared in the press from Drs. Osterholm and Santopia. You only need to Google and you would discover that the father of modern infectious disease understanding, Robert Koch, who had discovered the bacteria that causes tuberculosis in 1832, had been experimenting with anthrax in 1870, just 5 years after the Civil War, and had actually discovered, believe it or not, how many elixirs it takes to get to the center of a throw pop for infectious disease. To crack the enigma code of infectious dose. 1870. Did you know that today, because of advances in technology, we don't even have to recruit 38,000 people to have live wild virus injected into their nose, because we can use what scientists call E6 virocells. And yet, in a pandemic, when it seemed like all time had stood still, a apparently the most distinguished scientist in the entire world, and the world around, had forgotten how to do basic science that they had been doing for over a century before. And if you think that that is rather bizarre, just wait until you hear the story about what happened at the White House when this vexing question was posed in a simple FOIA request for agency records. Now, some 5 years later, arriving at the Supreme Court, believe it or not, again. Apparently, the last time the U.S. Solicitor General Elizabeth Prelogar had elected a right to remain silent, with no report to the press, and had waived any comment from the government unless ordered to do so by the Supreme Court. Clearly, the Supreme Court did not order any response, and so none was given back then in 2022. And in this case, essentially saying in official statements that the government can neither confirm nor deny. All that is spooky stuff. And apparently, Dr. Anthony Fauci is not the only one electing a right to remain silent right now. He is just the only one doing it in the news. Things that might just say,
The most famous sentence Howard Baker ever uttered was his immortal line about Watergate. What did the president know, and when did he know it? The inquiry ends there.
This message was approved by Major Mike Webb. Honest.
It's acquaintance. Always.